Hello, everyone. Good morning, good afternoon, good evening to you, wherever you're joining us from. On behalf of Team Uteri and Boost Learning Team, I welcome you to this session, which is a second part of the series, Community Activation in the Era of COVID-19 Pandemic. And this particular session will be focusing on using community engagement to tackle COVID-19 vaccine hesitancy. This session will center around community activation for immunization professionals. And this community activation simply means how each and every one of us can transform our communities in ways that will inspire people and encourage those who are less active to get more involved in the immunization program. Next slide. Yeah. So as you all know, we're using the Zoom virtual platform for this session. So we would like to request that you all mute your microphones when you're not speaking to reduce background noise and feedback. And we'll encourage you to use the reactions button at the bottom of your screen. You can raise your hand during the session if you want to speak. And you can also dialogue with your peers and the facilitators of this session by using the chat function. And most importantly, we'll encourage you to rename yourself, rename the device you're joining with, using your first name, last name, so that we can record your attendance for this session. And to rename yourself, just go to the participant list and click on your name. It will give you the option to rename, so you can do this. And if you've not already introduced yourself, you can introduce yourself with your name and your location so that we would get to know you and where you're joining us from. Next slide. So we have the following lined up activities for today's meeting. And we hope you're going to have a very engaging session with us today. Next slide. Yeah, so I'm sure a lot of us would have seen the name Uteri in the emails that was shared with us when we were inviting you to join this session. And you'll be wondering what this means. So Uteri means light. It is in Kikuyu language from central Kenya. And in May 2021, a number of us started on a journey with the Boost team and the People Power Health team, where we, over the course of 3 months, learned some very important skills in the advanced training in community activation fellowship. And today, myself and other fellows from this fellowship that form the Team Uteri want to share our experiences with you, want to share all that part of what we learned from the session, and we hope that you also share your experiences with us regarding community activation. And Team Uteri, like I said, Uteri means light, and our team's purpose is to work with other members of the Boost community so that we can share experiences, provide peer-to-peer support, and learn from each other while we work to activate our communities. Next slide. So now that I've told you what Uteri means, it means light, we can move on to the next big question. Who are the Team Uteri? So the Team Uteri is made up of 5 people from 4 different countries across the globe. We have Adunola Oyegoke from Nigeria, a field epidemiologist. We have Asif, Sher from Pakistan, a junior technician. We have Danjuma Makoshi from Nigeria as well. He's a M&E manager and research manager. We have Joseph Mbari Ngugi from Kenya. He's a senior community oral health officer. And we also have Sohini Sanyal, a learning capacity development expert from India. So as you can see, we have different people from different areas that made up this team. So can the Team Uteri members unmute their mics and say hello to participants?
Hello, everyone.
Hi, good evening.
Hello everyone. Hi, good evening.
Hello, everyone, and good evening.
Yeah, hello everyone. So if you're new to Boost, I would like to give you a quick overview of what Boost is about. So the Boost community is a global network of more than 17,000 immunization professionals from over 130 countries. And we provide numerous chances for community members to actively interact and engage with peers, enhance their leadership and advocacy skills and abilities, and advance in their careers through the online platform, boostcommunity.org. And I would like to invite anyone who is joining us for the first time to register. So you can register on boostcommunity.org. And when you log in, you become a member of this community. And it is very important that you register and join this community, as it will open up access to a wide variety of resources and materials, as well as different course offerings, which you can take. At the end of this session, we'll be providing you with additional information. So now I will hand over to Danjuma to give us a run through of the next activity. Over to you, Danjuma.
Hello, everyone. I would like to welcome each and every one of us to this session. And for now, we are going to breakout rooms where we are going to discuss with each other. Feel free when discussing with our colleagues, our peers. And I would like us to acquaint ourselves with each other as we are discussing in our rooms. Aside from that, we will be sending you to your breakout rooms in a minute. There you will be meeting others in your group. And you will be talking through topics relating to your personal experiences, as well as your community activation challenges you are facing and how you are benefiting from part of it. And to align with the Boost community, also how you are ready to get knowledge in immunization and other part of your life. So in your various groups, you will discuss around questions. Can I have the next slide? All right. Some of the questions that we have here. For the first question, what has been your experience with community activation? We all know that we are faced with different challenges and how we intend to work around the community activations. But I would like to know about your experience with community activation. And the second question is, we would like to know about your challenges that you face in community activation, especially in the area of COVID-19 pandemic. Feel free to share any challenges that you are facing in community activation. We'll also go further to discuss on what do you know and feel about Boost community. In Boost community, we know that we have members, maybe some are not active, or some are just coming in new. So we would like to have your view on Boost community. Then aside, the last one is, how can the Boost community help you to engage and activate your work in your community? So we're going to have you align with these questions. So feel free as we are moving to our various groups. We are going to take each and every one of these questions. So we are going to discuss them at length. And after that, we are coming back and discuss it in the larger group. So I would like to invite MJ to assign us to our various group. So you are going to see a pop-up asking you to join.
Great, so everyone should see a pop-up on their screen, and just be sure to click on that button to join your group. And we'll share some reminders to let everyone know when we'll be coming back to the main room.
Hello, welcome back. Is everybody on the house? Is anyone here?
Yes, you are here.
Some 2 minutes for
Yes,
everyone to come back. Okay, welcome back. So for this session, I would like the facilitators to share their experiences in their various groups. So first and foremost, I will call Sohini. After that, I will call Adunola. Then I will give my feedback. Thank you. Go ahead, Sohini.
Hi, Danjuma. Thank you so much. So I'll just share my screen of what we were doing right now. So as you can see, we've had quite a lot of great inputs coming, and we were able to talk about all the 4 questions, and we heard that community activation has been something that everyone has been doing for quite a long time, and not surprisingly, the question automatically really changed to the challenges that people are facing in the COVID era. So we had points about how earlier on a lot of time was given in order for them to talk about any kind of introduction of vaccine, getting people mobilized. But what Anthony pointed out was that these days the COVID vaccine has a short expiry date. So people need to really quickly mobilize the activity, the community, and that is a challenge because they don't have much time. We also heard about how COVID-19 is making it essential for repeated reiteration of COVID protocols and working with small groups. So that is also a challenge. Earlier, people could engage with bigger groups of people. Now they have to engage with really small people, and they have to do it repeatedly to make sure people are following these protocols. We heard from Lucy, who said mobilizing teams for training for COVID, for other vaccines, it has been her experience in community activation, and that's what she's been doing a lot lately in terms of working with the community. Now, when we came to talking about the Boost community, everyone, of course, has heard about the Boost community, and most of them are also very aware that this is a great place to learn more and improve their knowledge about immunization. Anthony talked about how he heard the story of the rock in one of the courses that we've done. It helped him. Adaptive leadership helped him. Martha spoke about how Boost is helping the frontline workers come to the forefront, increasing their knowledge, their skills, and not just focused on a smaller group of people, but really focusing on bringing to the limelight the frontline workers who are working day in and day out. And Martha also came up in Fatima's, Ginyu's comment that Martha was the one who introduced her. So we see a lot of peer referrals happening, and that's how people are getting to know about the Boost community. We had Nina, and she talked a little bit about her facilitation in the community activation course. So these are new things that she was able to help facilitate, new things that we could learn. Safa said that Boost community has provided an opportunity to access more resources on information, improved her knowledge, and also expanded her area of work. In terms of how the Boost community can help, participants engage better. We had a question on CPT points from Lucy. It seems that for promotion, for growth, CPT points are important, and there is a question about how if Boost can really contribute to that part of the participants' development as well. And Lucy also said that, she has also been able to use her knowledge on adaptive leadership, and she has been able to further share that knowledge along with her communities. And we were also very happy to have a first time, member who's joined today as the first meeting, which was Fatima. And she's learned about Boost from her colleagues. So we hope, everyone had a great discussion, and we will continue to tell you a little bit more about how you can engage with the Boost community and your communities going further. So Danjuma, I think over to you.
All right, thank you, Sohini, for that great insight. Adunola, can we hear from you?
Yeah, thank you, Danjuma. I will share my screen so that I can run through what the discussions were in the breakout room. So regarding people's experience about community activation, the recurring theme around that was that usually when community members are involved in a program, once they're encouraged to take ownership, that the program is usually successful. So the community members are seen as very important part of program implementation, and that the community participation is also important for the success of the immunization program. And in community activation, different categories of staff work on educating community for health programs, and community activation also helps in motivating health workers to carry out their duties. Then Alex mentioned about community theater for immunization, which is being done by our organization, which uses human-centered design, and it encourages the community to take ownership, and they create theater content with the community, which is used to drive demand for immunization. So regarding challenges that people are faced in community activation during the COVID-19 pandemic, the challenges range from managing fear in individuals who are afraid of contracting the virus, inadequate human resource for health, where there is not adequate staff to carry out community activation work. Then challenges with reaching out to outreach communities. And despite the fact that mobile unit is being used, there's still these challenges with reaching the community. Then there's also talks about financial constraints in carrying out this activity, low turnout for second dose COVID-19 vaccination, then inadequate resources at subnational level, which do not allow the subnational levels to have autonomy. Then misinformation has been a major challenge, especially those that has been spread through the social media platform. Then there is problem with reaching out to community with the right message. There is the challenge of vaccine hesitancy, as well as inadequate resources to reach the entire nation. Then lack of information on availability of vaccines and where to get this vaccine, as well as low risk perception in communities. So people know about the Boost community, and what they know includes it being a platform for immunization professionals. There's information sharing on the platform, there are course offerings, and there are also other resources available. It's a platform that allows global immunization professionals to share experiences, knowledge, and it is seen as a good initiative as it helps to build skills that individuals can use to develop their immunization programs. It also helps in building capacity, helps to learn from peers, and helps to learn from lessons around challenges and successes from other professionals around the globe. It also provides a connection for the immunization professionals, and it helps in an expanding network. And it's also a platform that recognizes the role of immunization professionals. Unfortunately, we were unable to get to the last question before we ran out of time. So over to you, Danjuma.
Sorry, thank you very much. I'll share my screen with you. And submit it, please.
Okay. So while we wait for Danjuma, you know, in the interest of time, I think we can go ahead. But those who are in Danjuma's group, if you would like to share in the chat box, share your comments, what was discussed, that would be wonderful. We'll all read and see what was discussed. So moving on. Yes. So, you know, we tried a little bit to introduce about what we have been doing for the past about 4 months. We've been engaged in a great cause, and we are putting this up as a capstone project from that course that we did called Advanced Training in Community Activation. And one of the things that we learned was, you know, public storytelling, you know, public narrative, where we talk about ourselves, our own story, why it is important, why is community activation important, which is, I think, something that we took a look at in the breakout rooms, you know, where you all shared your experiences and your challenges with community activation. So our call to action really is that, you know, we would love to see you all engaged more with your communities where you work. And I think the Boost itself gives a great opportunity for people to engage in the Boost community itself, learn from each other, work together, form great teams, form great bondings. And these are actually the skills that you can really take to your communities and implement as well. So two of the things that we would love to have you do today is you're all a part of the Boost community. You're all a part of the Boost platform already. The link was also shared previously, but you know, the link can be shared once more. Please join the Boost community platform. You get to see a lot of interesting courses and events there, which you can be a part of. And, you know, considering that we are all in the era of social media and we are much more used to working on platforms like WhatsApp, Telegram, etc., you will also see that there's a new Boost Telegram channel. So again, that's the link that can be shared on the chat for all of you. All you need to do is click and join that Telegram channel. It helps you get you know, very quick, handy updates of different kind of courses. And the reason I'm stressing on that is because we don't always get a chance to go into the platform and look at the events and decide what we want to join or what we don't want to join. But at least the Telegram channel gives you, you know, very quick reminders. And then if something looks interesting, you can go into the platform, learn more about the objectives, learn more about what you will learn, and go ahead from there. So moving on to the next screen, please. The next slide, please.
Yes, it should be up. Reasons for being active in Boost.
Okay, then it's my net. No, I don't yet. Are others able to? Perfect. We can see it now, Liz. Thank you so much.
Okay.
So, you know, a lot of you are new, or even if you've been on the Boost platform, you probably have not been able to engage much. So some of the benefits that you will see is that there are a lot of great sessions by very experienced facilitators. So for example, we have, you know, the People Power Health group, that they're the ones that took us through this great fellowship that we did. We have adaptive change advisors. A lot of you talked about the adaptive leadership courses, which the new members have heard about. We also have very technical public health related courses done by, you know, organizations like WHO, by John Snow. You know, we have courses like supportive supervision, Red QI. So you have a blend of different kind of sessions that you can choose from. And like we heard in some of the breakout rooms as well, there is a motivation for every one of you, because Boost really puts the spotlight on you. There are series like the Bright Spots, Sparks, which intends to have you share about your work and that way share your experiences with all of us. There are additional customized trainings. The reason that we feel that you should be engaged in a consistent manner is because those who are active on the Boost platform, there are certain trainings where we are the first cohorts, because we've been attending a lot of trainings. So, you get a chance to get into these customized trainings and learn more and improve your skills. Participants, your opinions, your feedback is respected. There are surveys that you see after every course, which you can, and then there is a live feed for every course where you can continue your discussions. And I think most importantly, since we've been talking about the difficulties that we are facing in COVID in working with our communities, I think the sense of belonging that you get in working with a community is probably the best motivation for anyone to join any community. And that starts here. That starts really right in the Boost community itself. We've all felt that when we struggled with our own challenges, we had people to support us, and you will feel the same. And I think together you will be able to learn a lot and get through these kind of difficult times as well. So going on to the next slide, please, Liz. And I think that might be taking up a minute to come on my screen. So as the last slide comes up, the last slide really talks about the fact that, we sometimes have a lot of our own challenges, maybe personal issues, maybe we are trying to bring change and it is not easy. Communities can be resistant to change. You know it better than all of us. And sometimes you might feel that, you yourself are on the verge of giving up. Probably that's also a reason why a lot of us are on the Boost platform, but we are not able to join the courses that we want to, or interact with our peers, learn from each other in the way that we want to, because we have a lot of workload. But it is for us to remember that we have a light that shines within us, and it's that light that needs to shine in the community. When the communities that you work with see that light in you, that's when they get motivated. And I think Leonard Cohen's song Anthem is one of the best ways to close this session, which says, ring the bells that still can ring, forget your perfect offering. There is a crack in everything, and that's how the light gets in. So even if you feel that you have been cracked open because of so much of worries and stress and COVID-19, but that's how, you will get the light shining from others, your peers, everyone on the Boost community. And that's how your light will also shine to the others in your community. So we have tried our best to tell you a little bit about our experience, and we hope that you will feel motivated to remain engaged in the community. And ultimately, of course, it is up to each one of us, and we will try and support. We are also there. You can ask your questions to us also on the Boost platform, on the Boost Telegram. So that's all we really had from our team today. And before I hand it over to Liz and MJ for their final closing comments, I would just like to take a minute and thank Peja and Nina, who are here on the call with us today. They took us through this really great 4-month course called Advanced Training in Community Activation. And whatever we have shared today is really because of their coaching and mentoring. So thank you to both of you. Thank you to Liz and MJ and the rest of the team, Yvonne. They support us in all these events that we try our hands on for the first time. So thanks everyone for joining, and over to Liz once again for the closing of the session.
Wonderful. Thanks so much, Sohini, and to the entire team for an excellent session today. I popped into a few of the rooms and it seemed like there was really great discussion there. So like Sohini said, we just have a few next steps and actually course offerings that are coming up soon. And one, I guess, announcement that I have to make is that we just launched our COVID-19 Listening and Learning podcast. For those who are familiar with Boost and this series, it exists in a live engagement form since May when the series launched. but we're now actually recording podcast episodes so that folks can listen to them kind of at their convenience. So I think we've shared a link in the chat, but I would definitely encourage you to check out the first 2 episodes that were released yesterday. They're only about 30 minutes long. And there's some really great conversations with folks that have already implemented or rolled out the COVID-19 vaccine in their communities and how they've kind of successfully done that, and some lessons learned that could be shared to others around the world. So definitely check that out when you have a chance. And then our other offering, a course that's coming up soon in mid-October, is a training on responsive feedback. So a few weeks ago, we hosted an information session with The Curve. And that's the organization that will be facilitating the training that starts in October. You can go back and actually listen into the info session if you're interested to learn more about kind of this concept of responsive feedback, which is really a process that helps practitioners use data to make better decisions and increase program success while active in the field. So again, we've shared out a link to learn more about that training. It's going to be a 6-week course with weekly live sessions. We're really excited to bring this topic of responsive feedback, which is new to the Boost community, and are excited for you to participate. So I think with that, I might just go ahead and, again, a huge thank you to the team who presented today's session. I don't know if Sohini or others have any other closing words before we end the session for today. Oh, I will also mention that we have a post-session survey too. So thanks, Yvonne, for posting that in the chat. We'd love to get your feedback on today's session, and we'll also send out the link after as well, so you have a chance to fill that out. Great, so I'll just say thank you again, everyone. Enjoy the rest of your morning, afternoon, evening, wherever you're joining us from. Have a great day.
Thank you, everyone.
Thanks, everyone.
Thank you, everyone.
Bye-bye.
Thank you, everyone. Bye-bye.
Bye.